Let's go. Let's start.
Okay, fine. Uh, Thank you all for joining in. Here, I would like to introduce today's session facilitator. This is Dr. Sarosh Saleem. She is Assistant Professor Bioethics, Head Bioethics Unit of International Network of UNESCO Bioethics, Shalimar Medical and Dental College, Lahore. She has done her master's in bioethics from AKU and fellowship in pediatric bioethics from Children Mercy Bioethics Center, Kansas City, USA. So here Sarosh is going to share her expertise in ethics and medical field. These days we are encountering COVID-19. So how people are dealing with it, she will discuss with you. So over to you, Sarosh. And once again, thank you all for joining us.
Assalamu alaikum, everybody. Thank you, Almas, for having me here. I'm just trying to put the slide up. So, can we share screen, Almas?
Yes, you can.
Yes, got it. All right. Bismillahirrahmanirrahim. So I'm going to talk about some of the moral challenges that healthcare providers in Pakistan are facing. I know that there have been a lot of discussions, and this might not be something very new, but a couple of things that I personally feel are more important to be discussed in Pakistan. We'll probably discuss that, and hopefully we'll have a good discussion around it. So first of all, I don't have any conflict of interest, financial or any others, while doing this. And secondly, then I'm going to talk more about the clinical side of the challenges, and certainly not about the research challenges that are being faced during this pandemic. What are the common moral or ethical challenges that we all as healthcare providers are facing, and what are the responsibilities of not just only healthcare professionals but also of the organizations and the government and institutions and other leaders as well. So challenges, what are the ethical challenges, moral challenges? They certainly have arisen from when we have during this pandemic. What has happened basically is that healthcare providers who've been trained, look into the best interests of each patient, take care of each patient, and make decisions on their clinical judgment, what is the best for that patient. That kind mode has kind of literally switched from one specific patient or family to immediately towards a more public health kind of an approach, where we see that there are issues in taking care of or maybe maximizing the benefits for maximum number of people. So the mode has actually kind of shifted from patient-centered healthcare, patient-centered approaches towards more of an approach towards a public health approach. So just quickly going to talk about, when we talk about ethical issues and ethical reasoning and moral reasoning, how we make decisions and what are the moral reasoning or reflections that we make and why we make these decisions that we make. So obviously there are three schools of thoughts and three different ways commonly that we make a decision upon. First is obviously the agent, if we are a good human being, I'm a good human being, I must be doing these things. So not killing somebody, saving a life, telling truth. These are the good, what a good person would do in any situation. Then there are when we judge our actions. So what happens when, what kind of an action is killing, what kind of an action is not telling the truth, so on and so forth. So basing upon our actions, or judging upon the actions or the act that is happening, we decide if this is an ethical situation, or if we um, if this is what I want to do in this situation. And then the third thing is, obviously, we look at the consequences. So based on the impact of the actions or the decisions made, what happens when we do this action, and what happens and how it affects people, and whom or how it affects. So based on the consequences when we make decisions, those are the decisions we make. So the reasoning is that we want to improve the consequence of the situation. So like we talked about, what has happened, what has changed during the pandemic is that although we all are reasonable people, and we have sometimes different sort of moral reasoning, different agent coming reason for making a decision, but in general, in this pandemic situation, we are facing a lot of challenges, which we were not facing in a regular time most of the time. So, so some of the common challenges. Sorry, I just have another screen on top of this. I'm sorry. So some of the common challenges that we are facing is obviously social responsibility. I'm going to talk about solidarity, risk and benefits, and obviously most popular of that everybody likes to talk about, resource allocation. And certainly we're going to talk about it. I think social responsibility is one of the very important factors, and it kind of, sorry, I'm struggling with a few things at the moment. I have to admit people side by side. Sorry. So social responsibilities, obviously, that is a moral challenge at the moment. That if I'm not taking care of myself, or if I'm, not exercising, not taking a healthy diet, it's going to affect me, my body, and I'll be the one facing the consequences. But if it's a communicable disease like the coronavirus disease, then obviously I can infect other people. I'm not following social distancing, and I'm not following the routine guidelines of hand washing and stuff like that. So obviously I'm uh, making other people at risk of getting that disease. So social responsibility is certainly one of the moral challenges that obviously our society around the globe, everybody is facing that. Some people, you see, some people, not even my cats are, some people are trying to keep a safe distance, but most of us that we see nowadays on the television and screen and everybody on the roads, that some people are not. Again, coming together, that certainly is another moral challenge that we are facing at different levels. So it's just not only the individuals that need to take care of each other and the people around them, but also it's the organization, and organizations need to take care of the people. And obviously the state, the country has its own responsibility towards the frontline workers and towards the general population and everybody. And internationally, globally as well, we see that people, the more resourceful countries, they have responsibilities, and they should be, feeling responsible for the not so well-resourced countries and societies. So I think a few of the most difficult things that everybody is from us is facing, the healthcare providers, basically what they're facing, few of the challenges of our duty to care, because obviously we have taken a note and we are responsible for health for providing care to the patients and to the society and to all those who are suffering. But what I observe is the most difficult challenge at this point in time, and it's globally, but obviously in Pakistan, what we see is that most of the healthcare providers they are not being able to care for the regular patients that they would do in regular times. So it is certainly challenging that. There are patients who require care, but they are not coming to the hospitals for different reasons, including obviously they might not have transport available at this point in time, or the hospitals have closed down their OPDs or elective procedures, or because they're afraid to get infected, so they're not coming to the hospitals. But certainly healthcare providers are finding it difficult not to be able to care for the routine patients who require care, and to alleviate the suffering that they are facing. That is certainly a big moral challenge. So some of the other challenges that come in this respect is our respect for patients' rights and patient preferences, and we see that since obviously we do not have any sort of legal or way or mass directive, we often see that in situations like these, when you cannot see a patient directly. I mean, the, the patient sees their healthcare providers, and there's so many things. They have masks, they have the face safety gadgets, and they're wearing PPEs. So it's not the kind of a regular kind of a situation, patient physician relationship. And also because the families cannot so freely and frequently cannot meet the patients or the healthcare providers. The situation is certainly difficult, not just only for healthcare providers, but also the patients and their families as well, because they're unable to meet with the loved ones in such a difficult time when they are suffering from a disease. Um, Balancing between harms and benefits is another difficult challenge that healthcare providers are facing, and it's risk and challenge not only to the healthcare providers but also to the patients, because in hospital you may have different patients, and so protecting non-COVID patients from getting infected, and obviously to limiting the infection of COVID to from spreading into the population and going into the community. These are again common challenges. So UNESCO's fourth article, UNESCO's Declaration of Human Rights, it states that so as healthcare providers, we're responsible for maximizing all the benefits to the patients and minimizing all the harms to all individuals. And obviously, that is in line with the four main principles of ethics that we always talk about. So, beneficence and non-maleficence. We're talking about protection and protecting not only just healthcare providers but patients as well. It's really very important, and what I think it was more of a struggle earlier on in our country, probably not hearing about this right at this point in time, the lack of PPEs, etc. But at the moment, apparently all the hospitals and healthcare providers have it, but foreseeing the availability of safety material is difficult at this point in time. And but but that's the most important thing. And I think safety does come first in everything. I mean, you're flying in an airplane and they tell you that uh, if there's an emergency, there's a situation, you put on your oxygen mask first and then help somebody else, so you gotta be careful for yourself, so the basic life support, the first thing that you do is, if you see somebody is lying unconscious or something, first thing is you make sure that the scene is safe. So being healthcare providers, we've been trained to do that, and we are supposed to do that, because I know that sometimes emotions run high in these situations, but it's an important thing to remember that that's a basic a basic mandatory step that we have to follow. That protect yourselves first, and then you can obviously be in a position to help others as well. So we've seen that discrimination or stigmatization around this COVID disease has been around the world, but in Pakistan too, at certain levels, we've seen that uh, it's been very stigmatizing for people. I've heard about people who got infected, and some of them are healthcare professionals, and the neighbors uh, got together and just told them to not not self-isolate themselves in the apartment buildings, just because they might spread it to others. So we've kind of started stigmatizing the patients. And also what we've recently seen, it's not, the violence in healthcare is not a new thing in Pakistan, but it was so not expected at this point in time, where the whole society is literally dependent on healthcare providers, and the kind of paying them all regards and all the stuff on the televisions and social media. But what is actually happening is that they are being violent against healthcare providers, ruining the healthcare facilities. And so, that is certainly a very difficult challenge. And also another challenge is about the inequality among within our healthcare system. We have public sector hospitals and we have private sector hospitals. How do we make sure that every patient or every person in the society gets same level of healthcare, good quality healthcare? So that is, I think, is one of the main ethical challenges or moral challenges, which is there every day. But certainly for now that we've realized how important healthcare systems and how healthcare organizations and how important it is to invest in them, I think it's become more of a challenge. So to make sure that every citizen of the country gets the same level of healthcare. Then we know that we have so many marginalized population. We have people in rural areas who do not have access to healthcare systems like we do in the cities, in the big cities. That's an issue. We have a lot of immigrant population. So, if we go on to Khyber side or Farda side, we know that there's Afghan immigrants and even others. So they might face some challenges because of, again, availability of healthcare resources. So now coming to resource allocation, that is one big area of ethical challenges that I think everybody in the world is facing, but now what we are facing. So there are different ways of rationing that have been suggested. I don't want to go into too much detail of that, because I believe that different organizations and different institutions have their own policies, and they have their own ways of doing things. How do we approach? How do we how we provide quality care to everybody? That is certainly a challenge. We want to maximize benefits, certainly. Obviously, it's the most common thing that happens is that, on the clinical basis of patients' symptoms or severity of disease, you decide who to give care first. So that is one way of doing it. I'm sorry, I'm just um, having some. I'm sorry for this inconvenience, but so we can prioritize on different levels. So patients who are sicker get treatment first. Obviously, the kind of triaging that is generally done on a regular basis. Then there's been a voice about prioritizing healthcare providers, that the healthcare providers should be tested, and they should get vaccines first, and there should be testing. And I just saw this morning from one of the private sector hospitals in Karachi, and so they've been talking about how they have tested all their healthcare providers and how mass testing of healthcare professionals should be mandatory and done. So yes, there are different things that should be prioritized to healthcare providers. Certainly, the PPEs, but then there are different opinions about other. There are different rationales, reasonings for other things. First come, first serve basis can have its own merits and demerits. So the disadvantages or the unfair advantages go to people. So there are people who have easy access to healthcare institutions or healthcare providers, and then there are people who live in far-flung areas or in the rural areas, and they would probably not be able to reach in time. Or so first come, first serve basis might kind of be challenging in that situation. Um, how do we divide resources? How we make sure every organization has its own resources and they have their own policies which are being in place, because I personally think, I'm certainly different people may have different opinions, but I personally think that talking about just about ventilators and the non-availability of ventilators and how we should allocate ventilators today uh, kind of seems very ironic to me, because there has never been a day in Pakistan, not at least since when I became a doctor, when there were more people in need of ventilators and there were less available ventilators available. So either it was that there were people who could not afford private sector hospitals, and there were no available ventilators in public sector hospitals. Day in, day out, the critical care providers, the emergency doctors and nurses, the critical care ICU doctors and nurses, they have struggled with the fact of how to allocate resources, how to, who gets the ventilator kind of a question. So it seems very difficult for me to understand why just now are we talking about it. So I'm going to talk about it a little later, how we have struggled so far. So obviously there's been opinion that research participants, just like healthcare provider research participants, should also be prioritized when allocating resources, because obviously we recognize them as socially responsible, being part of a research project and stuff like that. How we should apply the principles, how we should make sure equal access to COVID and non-COVID patients. That again is another challenge, and that is an opinion that there should be equal access to every patient, and all these ways of allocation or rationing the resources should be done the same way. So we do have scarce resources, and I shared it earlier with another group, but I find it very interesting that this picture was shared by one of the healthcare professionals in UK, and they said that they opened the boxes and they were told that they're getting breathing machines, and what they found was this. And I thought, oh, okay, so uh, these are sort of ventilators in our healthcare system, in our public healthcare systems. All you need is one attendant and these ambu bags, and people bag their patients for days even, so um, again, irony is that we have never had enough ventilators, but we're talking about them now. So other than resources, obviously medicines, equipments, protective equipments for healthcare providers, they are a scarce resource. I think they're far more important scarce resource that we should be talking about always. Human resource, you know, I mean, it just feels strange to think about it, that here we were talking about COVID and corona infection coming to Pakistan in January, not even in January, maybe in February. And here we are, it's the end of May. And the kind of toll it has taken, not just physically, but emotionally, on healthcare providers all over the world and in our country as well, because we have our own issues to deal with. Then human resource is also one of the resources that we need to talk about, that it is a scarce resource. How we should utilize our frontline resources. Infrastructure obviously has been a challenge, and we see that it will remain a challenge. It's an ongoing challenge for us, especially. In my personal opinion, what are other scarce resources that we are hardly talking about? I talked about the emotional, the physical, and the emotional toll this whole scenario has been taking. But all these moral challenges, when a healthcare provider faces them day in, day out, they certainly cause moral distress, because we do not have enough ethical guidelines. We've never had any proper good ethical guidelines on a national level, on institutional levels even. So clinical ethics, or I think ethical training in itself is a big scarce resource that we've had. And I think that this situation has highlighted this very important aspect, that we haven't had enough training in these aspects, how to deal with these issues on every level, not just individual level, but on organizational and leadership level. And again, leadership, which is required in such times, is again an organized effort or leadership. That is also, I believe, is a very scarce resource, and we really, really need to, I think it's high time that we realize how important these basic ethics education, ethics training, having the proper ethics guidelines, the proper clinical ethics system, having moral safe spaces for healthcare providers, having good leadership who are there with the healthcare providers in such difficult times. We really, really need to pick up our game here. So we all know that this is a challenge which the whole world is facing, and it's not an easy one. No single person or a single organization or a nation can address it single-handedly. It basically requires solidarity from the whole world, and I think it's just an eye-opener for everybody what our priorities are as nations as well. I just thought we would discuss this situation or a case kind of a thing, but I believe we have a little time left, so maybe I'll just go on to open this for discussion. Will have any questions or input to what I said, but I think this is again one of the things that I talked about, and this was being shared on social media in the beginning of Ramadan, and a very strong opinion, even from some healthcare providers, came, and I thought that this was a very interesting scenario for case discussion, for ethics case discussion, because we can obviously talk about both sides on different aspects or perspectives on this situation. That is it, or maybe I can just end by saying, is it ethically permissible for healthcare providers just to say that the people who are putting them at risk will not be cared for? And again, I will just say that these small moral challenges, they build up and they create excessive moral distress, which cannot be dealt with unless the organizations and the leaders of ethics within the country, they come together, they make good structure of clinical ethics for our healthcare providers, a good resource for our healthcare providers. And I think that's where I'll just end the discussion and open for discussion and your valuable opinions and comments. So does anybody wants to maybe say anything? Or
Thank you, Sarosh, for sharing your thoughts and expertise. Anybody for questions, please?
so if nobody is has a point or a question, then maybe I can just go back to this slide of and start talking about and start asking. And so again, I'll go back to this question.
Sarosh,
like ethically permissible.
Dr. Sarosh, we have one. Sorry, I'm interrupting you, Dr. Sarosh. There's a question from Dr. Mehreen. What is your take on opening of public places without involving healthcare professionals and their opinions?
I'm sorry, can you repeat, please?
What is your take on opening of public places without involving healthcare professionals and their opinions?
Very good question, interesting. I think I think it's not the question of so again, if your question is that why healthcare providers' opinion was not involved in this, if it was not, then certainly it's a bad thing that if the healthcare providers were not involved. But in general, I think, and that could be just my opinion, that we might be taking things we might be asking a different a question, a sort of a question that might not give us good answers. If I say, if there was no involvement of healthcare providers, then certainly that was the worst move ever anybody could make, because healthcare providers are one of the major stakeholders in this situation at this point in time. Having said that, I think if the question is, should the places should have we opened up the public spaces? Should we have opened up the shopping malls? Should we have opened up the bazaars and all? Then I'll go back to the social responsibility of individuals. And our social responsibilities as society, because we have to balance the harms and benefits, and we have to see that if the numbers in the emergency rooms has dropped, or if I was in line, I was waiting in a public sector hospital or a free of cost hospital like SIUT, or maybe in this hospital, and I was waiting for my turn of any cardiac surgery or something for a year now, and March was my time when I would get the surgery done, and I waited for a year and a half or so. Is it not unfair or harmful to me? It is important for me. It is not an emergency situation for anybody else, but it is important to me. And for your oncology patient, for your dialysis patients, for everybody who need regular checkups, for vaccinations, the vaccination rate has dropped to more than like 60% in Pakistan, because obviously, we used to send healthcare workers down to the homes of people for polio vaccinations and all that. So we really need to balance the harms and benefits, and we really need to understand that it's a society. It's not an individual making a decision. This is the time when people make decisions not for themselves but for others as well. So I think it's inevitable. We might be debating this thing if we had lockdown for another 2 months or so. The things might have been more or less the same. We did help flatten the curve to some extent. I think it's a very tricky question that should be if the question behind it was that it's not, if it was a good idea to open up or not. I don't know, because again, this is a tricky one, and I believe that it's not only the responsibility of either government or healthcare providers. It's a responsibility of everybody in between and everybody around us. And it's just we are not making people realize that they're responsible for their actions as well. And I think we should be addressing it in a slightly different way, because it's very tricky. Keeping things closed is easier said than done.
Okay, thank you, Dr. Sarosh. And Dr. Bushra Shirazi has shared a point. A set of clinical ethics guideline has been made on the National Bioethics Forum for COVID-19 times. Dr. Bushra, would you like to say something? Okay. Okay, Sarosh, you were going back to your presentation and asking something to the participants.
All right. So I think Dr. Bushra's comment that you shared with us is very valid, and I know that the CBEC has made a guideline, and it has been shared with different institutions and with everybody, and with, I believe, the government as well. Again, I think it's a so National Bioethics Committee has guidelines. We know that, but I think I have a different perspective on this, and I think if it's federally, I'm not sure I will call it regulated, but if it has been organized by federal government, and it has that sort of position, that I believe there should have been more done on the clinical side. Even on the research, they've been very robust on the research ethics part, and even then we see that individual hospitals do not have even average kind of IRBs. So I think just having simple guidelines is one thing. Having it implemented, having it shared, and encouraging discussion and discourse into those things would be my suggestion. And I certainly know and admire all the work being done by CBEC or NBC or all the people around. But I think my more genuine concern has been around lack of ethics education among healthcare providers, because we need more people to be talking in these languages around us all the time. I believe Dr. Bushra will agree to this. Okay. I think it's almost like we've just left with 10 minutes. If anybody wants to comment on the situation that the last slide I presented to you about, is it like ethically permissible for some healthcare providers to say, and now that situation was in the beginning of Ramadan, and now we can maybe, like twist it and say, so those people who are willing to go to the malls or the shopping centers where there's no concept of social distancing, so people who want to go shopping and want to go on outside or hoteling, or maybe it's hotels or restaurants haven't opened up yet, but so people who want to socialize in that manner, we should not be responsible for providing healthcare to them. Would it be ethically reasonable to say such a thing? Just putting up a question.
Dr. Sarosh, I would like to reply to that, because I think because I know so many doctors and I can speak for those who are going through such situations. I think I would like to tell you a few of my female doctor friends are under a lot of pressure from their in-laws, because when they go out and come back from their duties, and the in-laws, of course, they are afraid of getting such infection from those doctors, and then they are looking at them as a suspect all the time, and thinking that they are the reason why their family is under this kind of pressure and this danger. So those doctors are under a lot of stress at their workplace also, and also when they go back home, and they are risking their own lives and their own direct blood relatives, and they are also under a lot of social pressure because of such situation. And when they see that the people around them, for which they are risking everything they have, are not responsible at all, and they are calling this situation, the whole COVID pandemic, hoax, and they are calling names on all of the doctors, that they are saying the wrong numbers and labeling everybody as COVID, and they're doing wrong and this and that. I know you have been following the news on the social media. So I think being a doctor is very not helping everybody out there as well. So especially the doctor themselves, because the government is not involving them in any decision making. Even the hospitals are not able to provide proper PPEs to the doctors, so they are putting their own money for all of that PPEs. So this is my point of view, that why few doctors have voiced their concerns like this. I know this is not right, this is not acceptable, but this was just my point of view.
Yes, you're absolutely right. I think, but you're right. The way the society has been reacting has been immature, and it's not just our society. We're seeing this happening all over the world. Does the other's attitude or the behaviors, or how the society behaves with us, does it allow us to change what we stand for, like what we talk about when we talk about mm, beneficence and non-maleficence, and talking about respecting human life and protecting human life and saving human lives. I totally agree. I'm on with you on this. I that there should be zero tolerance for this kind of violence and stigmatization against healthcare providers. But my question is, does the other's behavior guarantee sorry, not guarantee, does that require us to change our behaviors and our values or our moral responsibilities?
No, it shouldn't be. But what example I gave you is because when your child is at risk because of you, when your husband and your mother-in-law or whatever, and maybe some of our doctors have gotten infected, and then their whole family has been infected. So these kind of very difficult situations are, I don't know. I know I cannot rationalize this, but somehow when I think and when I stand in their position, and then I say, "Okay, maybe some laws and some things are made by keeping us, or specifically as doctors, in mind also. And I know bioethics is totally applicable to us also, but I don't know, sometimes I feel that few of the points are really biased towards the patients. So I don't know, maybe
I
I'm not
get your
able
point,
to
and
explain what
I
I'm.
totally agree with you. And I think you've said absolutely the right thing, that there should be policies, and that's what I'm saying. That you know you can deal with your emotional trauma of going through such situations. You can deal with that. You can talk to some people. You can do your own therapy. You can get some help, but going through this moral distress that you are going through, that it's the right thing to do, but you are unable to do it for certain reasons, not because your institution or organization is forbidding you to do. It's because you cannot do what you should be doing. You sometimes have to intubate a patient that that will not, intubation or ventilation won't, knowing that it won't help them. Sometimes you have to go to take risks of so much, so as much as risking your own families. These are the moral challenges, and that's why I said that we need better, more organized clinical ethics within the institutions, so that these issues can be addressed within the institutions. Because when these are not addressed, you can deal with your emotional trauma. Maybe it's not that easy. I know it will take time, but how will you deal with these moral challenges when there's a right thing to do and you're not unable to do that? And I absolutely agree with you. It's not easy. That's why we're talking about it, and that's why I'm insisting that the organizations and the healthcare providers and the ethics leaders within our country should uh, see this issue, and even on the national level, on the federal or the government level, the clinical ethics training, the clinical ethics in itself should be so much improved that you should be talking about these things within your institutions, within your colleagues, and finding ways of resolving them. And if we're talking about violence and stuff like that, that has been there in our society forever. When we talk about non-availability of ventilators, that's an everyday story of any healthcare provider giving service in any critical area in Pakistan. So what is new that has happened that we need guidelines now, and we never had guidelines? So, we really need to talk more about these things within the institutions, with the leaders of the institutions, and come up with ideas and solutions within the institutions or on the national level, so that these issues, this should not be your problem to think about it. As a house officer or a medical officer or a resident or a junior consultant, these should not be the things that you should be worried for. So that's why I'm saying that we lack these resources. And I think we really, really need to improve on these fronts, because this is causing so much moral trauma, moral injury to our young healthcare professionals specifically, that it's a very bleak future if we carry on like this. Because I know the situation has been highlighted, the issues are coming into light more, but I guess maybe you would agree that these are the challenges we face daily, isn't it?
Yes, I think I agree on that because the abuse towards the healthcare provider has always been there. And but what I feel today is that people are in denial. People are not ready to accept the fact that there is something which they cannot see, but it is there, and it is causing deaths and illnesses. And they have started the blame game that the government and the healthcare providers are the ones who are getting benefit out of it. And because of that denial, and then when they face something which they don't want to see, then all the frustration comes out on us. So definitely this has to be taken care by the hospitals or the organization we are working for, and our government. And I hope that such topics like we did today are discussed more and at a bigger level, because I see only 15 participants now. I was expecting a lot of them, because this is something very important, and as a healthcare provider we all should be talking about it. So I think that this should be discussed more and more and at higher levels. So thank you so much. I will just end my discussion. Just thank you so much for answering it in detail.
Thank you very much for your comments, and you're absolutely right. And I think we need to work on this, and these are not the things you should be worried about. And trust me, we're all with you, especially the our younger healthcare providers. You have a bright future ahead of you, and inshallah things will be better soon, hopefully. And I think, again, the way people are not taking things seriously and all, I think I will blame responsibility on other social sectors that are responsible as well. Our media, our journalists, our religious leaders, our political leaders. So all of them, I think it's really important that everybody step up their game. Everybody realize what are the consequences of the actions that we are taking today. Will be having those consequences, so they really need to feel responsible. And at the end of the day, everybody is responsible for everybody else around us. So, and thank you very much for your comments and concerns. I'm glad you talked about these, and don't ever stop talking about such situations and things. I hope that we are able to develop such spaces within our institutions where we can easily talk about these things with our seniors, with our colleagues, with our juniors. And yeah, thank you very much. So Almas, I think we are done with the time. Right. So I think I'll just thank everybody. Thank you for your comments, suggestions, for being patiently listening to my personal views on these. Thank you for being here. I mean, if anybody wants to share anything, they can reach out to me on my email address or to Twitter or Facebook. Yeah, again, I'll just thank you all, and thank you, Almas, for arranging this, and Ziauddin University for arranging this session for us. Thank you, everybody. Take care.